You were complaining of pain in your elbow. Please explain to me how it feels and point out where you feel the greatest amount of pain.
I mainly have pain in the elbow area, in the shoulder area, and when I move my head. I work a lot at my PC, and I definitely injured myself while playing tennis. I had a match that was really rough.
The symptoms that you are describing are typical. The starting point is tennis elbow. Then the body compensates, which leads to tension in the musculature. This area is painful. These are the muscles that lift your hand upward. These are called accessory muscles. In your case, in the elbow region, the medial and lateral epicondyles represent the biggest problems for the orthopedic field. Accordingly, the trigger points are also readily accessible for treatment. In the case of tennis elbow or lateral epicondylitis, the supinator muscle is especially important. Beside the local treatment of the attachment tendonitis, it also plays a crucial role in radiating pain in the region of the lateral epicondyle. We are now going to the trigger point. Please raise your hand for this purpose. Can you maintain this position?
Yes.
Please remain in that position. It's going to get a bit tougher now. Can you still tolerate this? In addition to treating the localized irritation at the muscular attachment, the trigger points of the extensor carpi radialis, longus and brevis and the extensor carpi ulnaris muscles play a decisive role. These are readily accessible and likewise are readily extendable and identifiable through distension. The application areas for the combined dynamic shockwave therapy on the trigger points range from simple excess muscular tension to a complex joint problem with dysfunction that also radiates down to and affects other regions and organ systems. And release. The principle of the muscle energy technique, which originally was conducted as part of an osteopathic treatment, is to conduct the diagnosis and treatment of a pathologic function on the musculoskeletal system in one step. Now I will pull out the muscle to release the metabolic products from your metabolism. The aim is to return the musculature, tendons and thus the joint function to a normal state, and thus to accelerate and, ultimately, to initiate the healing of the changed pathological structures. Set it down gently. How does it feel here in front? The technique is based on gentle stretching of the relaxed musculature until it reaches an initial pathological limit. The stretching does not continue past this limit. When this limit is reached, the patient is prompted to tense the musculature in this position against the resistance provided by the therapist. And release. The shock wave comes from the trigger points are constantly subjected to shock wave therapy during this treatment. That is to say, in the contraction as well as the extension, the shock wave device remains in the sensitive area for optimal tracking and completion of the treatment solution. Against my hand. And release. After application of this initial phase of therapy, the therapist searches for the next movement limit and attempts to achieve renewed relaxation of the contracted system under application of shockwave therapy. I will now treat the trigger points in the shoulder area, which always have a tremendous influence on the elbow. This is referred in this manner, the contracted muscle and thus the joint are gradually loosened and brought back to a full range of motion, step by step. Please let your arm back down again. Please tell me if there are painful areas here.
Yes.
The power level should be selected in such manner that it does not exceed a penetration depth of 3 centimeters in the region of the paravertebral musculature. In the muscles of the extremities, one can decide on various settings based on the physiognomy of the patient. And release. Push outward once more, please. And release. Thank you. Relying on the experiences from the muscle energy technique, it is recommended to depolarize a trigger point for 90 seconds. During this period, the extension exercises and the corresponding contraction exercises take place. Stretch out your arm and completely stretch out your elbow joint. Apply pressure upward. And release. Put your arm down in front again and relax. I'm going to smooth the musculature out here a bit. It is advisable to carry out this therapy twice per week. Below here. The entire scope of 10 treatment sessions is advised. I will now show you an exercise to do at home. Stretch the right arm out and, using your left hand for help, bend the hand downward. Now stretch it out against the resistance until you sense a feeling of relaxation. Hold for 10 seconds and then slowly release. Loosen up and then once again go into the extension. Repeat this exercise 10 times, mornings and evenings. Mr. Müller, we are finished with your treatment. You may get dressed again. I wish you all the best for a good recovery. Take good care of your elbow. Please do the exercises 10 times each morning and evening as shown, and then we will see each other next week. You can make an appointment at the reception desk.
Thank you very much.